to the second portion, I'd like to introduce Tom Zuber from Zuber Lawler, Olivia Mannix, she's a colleague of Dr. Coos at Aphrodite Health, and Henri Sant-Cassia of the Conscious Fund. And next we're going to talk about, the regulatory landscape, what investment opportunities look like, how they're similar to cannabis, and how they differ, because it is, its own animal in a lot of regards. But cannabis did pave the way. That's why Arcview is involved here. Tom, I guess we'll start with you. What are we looking at from a legal perspective? What are the hurdles? How far have we come? Where are we now, and where are we headed?
Well, I think it's a good note, Colin, to say that cannabis in some ways is a preview of what we might expect to unfold in the psychedelics industry, including as to regulation, including as to investments, including as to the growth of a legal industry. There are a lot of similarities and a lot of differences. I think that in some ways, the similarities reflect a bifurcation between legalization, increasing levels of legalization, it looks like, that'll occur at the municipal and even at the state level, starting with obviously Oregon, and obviously on the other hand, prohibition by the federal government. So that's going to play out in psychedelics as it did in cannabis, and other aspects are similar as well. For instance, you have in the context of that bifurcation, you have folks that are willing to take a closer look at assuming risk in the context of federal prohibition and launching companies and gaining the potentially large benefits of that. And we saw that happen in cannabis. It happened for my law firm 15 years ago. Nobody was touching cannabis work, and we were. And obviously we reap the benefits of that. It looks like that's happening in psychedelics as well. That'll happen for companies. It'll happen for financiers and investors, and that's a very exciting thing. There are going to also be some material differences. The cannabis market moved with a certain deliberate pace toward recreational legalization. And I don't think that that's going to happen in the same way in psychedelics. I think very few people do. This is going to be clinical, right? It's going to be much more medicinal. You're not going to be able to walk into a psychedelics dispensary and purchase something analogous to a joint to relax with your wife or husband or whoever at home. What's going to happen is you're going to go for serious treatment under the guidance of medical practitioners. And so that's going to be a material difference. And there are other material differences, and we could spend the whole set of hours just discussing those differences. But I think those are the highlights.
And now, Tom, I'm assuming cannabis kind of had a template, the path to IPO or the state-based licenses. This looks a lot different. What are the and as Henri mentioned, there's people coming at it from multiple different avenues, from the treatment side to the drug discovery side. From a legal perspective, what are the critical milestones we need to hit to push forward?
There are a lot of question marks that are underneath that question. So one of them, for instance, is the role of the pharmaceutical industry in determining the course of things. And I personally, I guess I have an emotional or intellectual or philosophical dog in that fight. We represent pharmaceutical companies, and we're honored to do so. But I can tell you that it's been a blessing in cannabis that prohibition exists, right? Because it was this opportunity for such a wide variety of artistry and innovation and entrepreneurship to rise up. And now we have such an exciting selection, such an exciting variety of cannabis companies and cannabis products. And we wouldn't have this variety if prohibition didn't exist, because probably, I mean, if you think about it, it would have, cannabis would have lined up in the hands of a few companies, and they would have been pharmaceutical companies. And I'm not sure that that's the best result. So for me personally in psychedelics, I would very much like to see a similar thing happen here, right? Where we can have psychedelic medicine has been around for millennia. And so here we are now finally focusing on it. But certain segments of our global community have been experiencing the benefits from this and touting the benefits of this for millennia. And so I'm quite worried about seeing one or two companies come in and sort of snatch the whole industry and to wrap it up in regulation or in patents or those sorts of things. So for me personally, I would like to see things unfold as they did in cannabis, at least to the extent that these entrepreneurs, these artists, these smaller companies had the chance to find their footing and to become larger companies and to find their own voice and their own place in the market. And then at some point, the larger companies will come in, but then you're going to have this bona fide variety where you have a much more diverse, a much more representative sampling of the global community that's actually bringing these products to a wider audience. So for me, that's one of the big question marks is how does pharma play into these things? Another big question mark is the FDA and what's the role of the FDA? Of course, there are some psychoactive products now that have achieved breakthrough status with the FDA. And that's, of course, for folks who don't know, MDMA and psilocybin were placed on the breakthrough fast track at the FDA, which means they'll have an easier time with trials and that sort of thing on a path toward some sort of regulated status. So that's an exciting development. But of course, psilocybin and other psychedelics still reside on Schedule 1 along with heroin. So as long as that's the case, and for folks who don't understand what hypocrisy that is, it's really quite terrible because in order to reside on Schedule 1, you're essentially saying that there's no known accepted medical benefit to the substance that's on Schedule 1, and that's a farce, and we all know it. So that's quite hypocritical. So how is the federal government going to address that hypocrisy? And that's something that we're going to have to wait and find out. So there are so many question marks that could shift so dramatically the development of this industry in one direction or another. But I do think that what we're going to see for the next couple of years is we're going to see an increasing number of municipalities and states that are going to at least decriminalize and perhaps even legalize commercially, on a commercial level, psilocybin and other psychoactive substances, as the state of Oregon did. California is pretty far along on that course right now. So California, for folks who don't know, it looks like we've just passed the point where we can start collecting signatures on a referendum to legalize psychedelics at the referendum level. And also Scott Weiner, a state senator here in California, is pushing legislation and seems to be, one, quite deliberate and focused and persistent about it, but two, actually seems to be making strides at achieving a buy-in, a sufficient threshold consensus of sorts amongst his colleagues in the California State Congress. Seattle, of course, just became the largest municipality to decriminalize psychedelics. So I think that we're going to see that play out a bit longer before the federal government figures out what it wants to do.
Thanks, Tom. When the business doesn't exist yet, you can be creative as far as the barrier to entry is whatever you want it if you're being innovative.
Yeah,
sorry guys.
To add just one more thing. So I know that there's a lot of, I've just been reading some of the comments, but so the really interesting and unique thing about the psychedelic space and using creating new medicines with psychedelics is that, for instance, the women's health industry is so underly represented, and women have traditionally just been, on the back burner and not taken care of in terms of clinical trials and such because of all the different functionalities of women's bodies with hormones and this, that, and the other. So looking at psychedelics to be able to actually disrupt the SSRI model where, if you have a mood disorder, you're just prescribed Zoloft or an SSRI of the such. So it's really interesting to see how we're using psychedelic medicines to help change the paradigm here. This isn't just about, coming up with something to make money. It's literally coming up with a brand new industry to really debunk and change what's been going on traditionally. And I know it's not a huge paradigm shift that, a lot of us very conscious and awake people like myself want to see, but we are light warriors and we're making small changes and steps to move forward. So I hope that you guys can understand that as well.
I'd love to actually just echo Olivia's comment because I think that that's a very important one. And the work that Henri's doing, financing these companies, getting out of the gates. The cannabis industry is a model in this sense because it really brought this medicine to such a larger audience. And I'm one of those persons, by the way. So I hadn't tried marijuana since college and really didn't care for it. And this was a long time ago. And it wasn't until I had been representing cannabis companies for, I guess, over 12 years. And then I finally decided to try a joint. And it wasn't a joint. It was probably an edible or something. And now it's become part of my life, and it actually is a joy to me. And I use it for recreational purposes and just to relax with family and friends and that sort of thing. But others have had sensational benefits that, physiologically and psychologically, and they never would have had these benefits if the legalized cannabis industry didn't happen. And that statement could be made about millions or even tens or hundreds of millions of people at this point. That's the case with psychedelics. And I can speak again from personal experience, because in the absence of the conversation that we're having right now, in the absence of the work that Olivia is doing and that Henri's doing, bringing these medicines to a broader audience, I never would have experienced benefits of this. And again, I don't have, there are so many folks that can benefit from these substances so much more than I can. And they wouldn't ever experience the benefits of this, but for the conversation that we're having right now. So I really want to applaud that notion that Olivia made, because if she's not doing what she's doing, and if Henri's not doing what he's doing, and if others like them aren't doing what they're doing, then this medicine is going to stay locked inside of a box. And I don't want to see that happen. I want to see it reach the furthest ends of the earth as far as the people that could actually benefit from the substance. So thank you, Olivia, for saying that.
Yeah.
So this is one from Carly. Who are the federal and state licensing and regulatory agencies who are either supporting or stifling growth in this industry? Have there been any federal crackdowns as there was with cannabis early on?
Well, I guess I'll handle that as the lawyer. The two key federal agencies are the DEA and the FDA, to a lesser extent the USDA. Let's focus on the DEA, because first and foremost, they're it right now, right? Until the DEA loosens its grip on the conversation, the FDA is going to be less involved, except in narrow surgical instances, like, for instance, in regard to breakthrough status granted to MDMA and granted to psilocybin. But this is really the key agency right now is I think the DEA, which is responsible for enforcement, including as to substances listed on Schedule 1 of the Controlled Substances Act. After that, it's the FDA. If the FDA can influence the conversation to a great deal, if they come out and start to accept and to articulate the benefits of these substances themselves, that'll have a dramatic effect on the conversation. But those are the three key agencies at this time.